Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What are the clinical features of optic nerve disease? So, if there is optic nerve disease, the patient will present with the following clinical features. We can see diminished visual acuity can be seen in the patient with visual field defects. If there are visual field defects, the patient can develop either an impaired central venous central vision defect may be seen. That means there can be a centrocecal scotoma or central scotoma is the most common visual field defect with defective contrast sensitivity is seen. Mainly whenever there is optic nerve is important for the visual acuity. So there will be decreased visual acuity, there will be visual field defects also, and there can be diminished light reactions are also seen because pupillary reflex also starts with the optic nerve. There will be impaired color vision because retina is important for rods and cones, and the impulses should carry through the optic nerve. So there is impaired color vision, there is diminished in light brightness sensitivity also, the contrast sensitivity will also be decreased, and near reflex is intact in unilateral optic nerve involvement. So these are the clinical features of optic nerve disease.
thank you and thank you for watching.